Good evening. Thanks for joining us on this Monday night. I'm Dennis House.
And I'm Lisa Carberg. As families prepare for kids to head back to school in a couple weeks, the State Department of Public Health is alerting parents of a contagious illness on the rise, whooping cough.
Infants are at the highest risk, but it really could happen to anyone. News 8's Brittany Schaefer has more on what we all need to know to stay safe.
Almost a tenfold increase compared to last year.
It's the largest outbreak in years. 93 cases so far in 2024 compared to just 11 all of last year, according to the Connecticut Department of Public Health.
Cough, 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 and then go, ugh.
The sound of pertussis or whooping cough is often a telltale sign, but kids don't always have the whoop. Yale medicine pediatrician Dr. Magnan Diaz says the highly contagious illness starts as a cold, therefore is infectious and spreading until symptoms worsen 10 to 14 days later.
It's really quite horrific to watch a child who has whooping cough or pertussis. As a parent and as a pediatrician, when you watch the baby doing that, they're really just struggling to get air in. 10 cases of deaths from pertussis in infants in the UK.
Dr. Diaz says a driving factor of the outbreak is vaccination rates are down.
You start to lose that herd immunity, which is very important because there's some kids who are just too young to be vaccinated.
Parents we spoke to today were shocked to hear whooping cough has made a comeback.
I'm going to be 70, so it hasn't been around in a very long time. And we used to get shots. The kids would get shots for it and stuff. And if it's on the rise, I would suggest the parents look into getting the shots preventative.
I haven't heard about a vaccine. I'm not the biggest on vaccines, but it's worth researching.
Stanford, Bristol, and the state's Department of Public Health are sounding the alarm, alerting healthcare providers and the community of the rise in cases, especially as kids return to the classroom in just a couple weeks.
I have grandchildren that are 5 and 3. They're at daycare age, and one child gets it, the whole class.
A big portion of the concern, right, is that when you have an outbreak that's going on and then you're bringing people indoors and in communities again, which is, of course, what happens in the beginning of the fall time, it is a little bit of a setup for a potential problem.
While infants under 1 are at highest risk, anyone can get pertussis. Diaz says if there's trouble breathing, call your doctor. Vaccines are widely available at pharmacies and your doctor's office. I'm Brittany Schaefer, News 8.